Hi class, my name is Joy Sparks-Simons and I'm a Master's in Public Health student here at Liberty University, and today I am going to present over eHealth. For my PowerPoint, when it's time to go to the next slide, I'll just say next slide, so it should be pretty easy to follow along with. So what exactly is eHealth? Think about the last time you went to the doctor. How did you make your appointment? Did you set that up through an app? When you went in and you checked into the doctor, did you check in on some sort of tablet, or was there an electronic check-in? When they called your name back and you went into the room and you were talking to the doctor, did he have a computer in front of him or a tablet, or was he using some sort of device? When it was time to call in your prescription, did they electronically send that to the pharmacy? Or when it was time to view any lab results you had, did you log into a system and put in your information to receive your lab results? All of these are examples of what eHealth is. Next slide. eHealth affects everyone. It is all around us, and it is one of the fastest growing areas of innovation in communication technology. Healthcare is a hot topic both in Washington and in each person's home, I feel like, and something that affects us all on a daily basis. eHealth is trying to play a larger role in empowering consumers to be able to take responsibility in the management of their own health, so that it's not like doctors have all the power and all the answers, but we actually have some say. So let's talk about some of the definitions of eHealth. Next slide. eHealth is the use of electronic information and communication technologies in the field of healthcare. Some examples of this are an EHR, or an electronic health record. It's an electronic version of a paper chart. For those of us that are old enough, we do remember not only charting in paper charts, but having paper charts or sending medical records from a large room that was filled with papers. mHealth is mobile health. This was actually a new one to me, this actual term. It's the use of mobile technologies, so things on your cell phone or a tablet for health purposes and delivery of information. This could also be your electronic health records, could fall under this mHealth. There's also health e-games, which are electronic games that basically encourage you to take responsibility for your health and your wellness. And gamification. Gamification is the application of games and the aspect of game playing to encourage engagement with a product or service. Some examples of gamification would be the Pokemon app, where everybody was out walking trying to find Pokemon. Next slide. So the background of medicine is that in the oldest traditions, we have always shared information. The way that this information was traditionally shared was verbally, and then beyond verbally, it was written for a written record. And now we are moving forward and we are sharing information electronically. This sharing of information is critical to the growth of healthcare in the digital age. However, this is not without concerns. Things like HIPAA are very concerned with the protection of the patient's information and with progressing technology while still making sure that it is keeping records safe and sound and the privacy of the patient is at the forefront. Next slide. So there have been a lot of recent developments. Since the expansion of the internet, this has really exploded eHealth. This technology has made eHealth what it is. The iPhone, as we know it today, really didn't boom until about 2009, and that iPhone and smartphones have made eHealth what it is through the app, through mHealth apps, telemedicine, social media, health e-games, wearables, and robotics. And we're actually going to talk about each of those just for a couple minutes. Next slide. mHealth, like I said, is also called mobile health, and it is using mobile technologies like cell phones or tablets for health communication and the delivery of health information. On the planet, there are 7.9 billion devices being used. And 36 of them are smartphones, which means that they have capabilities beyond just picking up a telephone and talking on it or snapping a picture. They can connect to the internet, and they can connect people in a way that we have not been able to traditionally connect. Phones are multifunctional. They can do videos, they can be your word processor, they can be an electronic organizer, they can be a calendar. The phones becoming smartphones has also shaped what eHealth is today. A device now can actually function as so much more than that. It can also be part of your diagnostics. It can be an EKG, it can be a thermometer, it can record amazing amounts of information that are important in healthcare. Health has truly become mobile with a mobile phone and a tablet and can go wherever you go. Next slide. Apps stand for software applications that can be added to any device and any type of mobile technology and or your computer. 6.1 billion users are expected to engage in their mobile apps on smartphones by the year 2020. That is an astronomical number of people who are going to be interacting with this health information. And so the healthcare and business sector are taking this opportunity and engaging individuals through health apps. 2009 was when a lot of these started popping up, like I said, and since that time, the number of health apps has actually tripled. There are 165 mHealth applications in major app stores being sold today. Apps allow smartphones to carry out diverse functions, and often they can track physical activity and can even monitor your heart rhythm. Apps can have gamification in them, and it uses the application of gameplay to continuously engage the user. And these are the most successful apps many times because people are competitive and they like to be entertained. Next app. Next slide. Telemedicine. Telemedicine actually is one of the older technologies, but it started with a computer, and in 2001 there was actually a remote surgery performed. Telemedicine is the use of telecommunication and information technology to connect healthcare to patients and patients' mHealth data remotely. So this has been traditionally important as an option for people in rural areas where there are not a lot of healthcare resources, or there might not be doctors readily available. For instance, I did in physician assistant school, I did a rotation in Alaska and a remote area where there was, physician assistants and doctors were not present, sometimes within a 5-hour drive from where people lived. And for this reason, it's very expensive to helicopter in. And so for this reason, we use telemedicine a lot. The idea of telemedicine is something that can be used to save money and to connect physicians or providers with patients no matter where that they are via some sort of mobile device or computer. As with most technology, there are both positives and negatives to this. Positives we've already kind of mentioned, but the negatives are you can easily miss something as a provider when you cannot actually physically see something, or you're giving instructions over the phone, or you can't actually have that person-to-person contact and communication. However, giving instructions could also, over communication could also be life-saving. So that's important to note. Next slide. Social media, all of our biggest love and hate on a day-to-day basis. Social media has also shaped how we interact with our eHealth, our electronic health. Facebook, Twitter, YouTube, Pinterest. It has been used by hospitals and individual providers to promote health and to also advertise for themselves. When it comes down to trusting it, the younger generation, the younger population says that 90% of people would actually trust what medical information is given out on Facebook, Twitter, YouTube, and Pinterest. I'm a little bit taken back by that, because I kind of view everything with a grain of salt when it comes to health information that is just, on somebody's random page. But social media has brought eHealth to where it is today as well. Next slide. Health e-games. It's a $6.6 billion market. This is used to provide entertainment and also to improve quality of life. So there's a few different types of these. There's exergames, health and nutrition, brain fitness, and condition management. So exergames are games that involve physical activity and movement so that it actually encourages the participant to live a healthier lifestyle. Health and nutrition would be something that is basically tracking your weight management and your meal planning. And sometimes you can earn points or things like that depending on your actions. There's also brain fitness games or brain training that basically make it so that you have to figure out puzzles and things like that to keep your brain sharp. And there's also condition management. So things like asthma, cancer, or diabetes can actually be tracked on these type of health e-games. Next slide. Wearables. This is an even newer area of technology that I don't feel like quite as many people have gotten into as a smartphone, but these include devices such as an Apple Watch or things like a pedometer, a smartwatch, Google Lens, a dermal device. It's an area of innovation in eHealth that is concerned with wearable technology that basically communicates biometric data regarding your heart rate, blood pressure, glucose levels, and more. It's a way to basically be tracked at all times. Next slide. Robotics. This is also a very exciting area. Robotics, it reminds me of R2-D2 and just the functions that we all kind of thought that was amazing, and that was a new thing, and that it was kind of the future of being able to do things, but that future is here. So service robots are a reality in healthcare, and robotics is used in everywhere from surgery to the pharmacy. Hospitals utilize robots to transport laundry. They use it for food, and they use it to deliver lab results. They're quick and they are precise, and they don't get sidetracked like people do. Another great place that robotics can be used in the hospital is in the area of sterilization. Diseases are spread often in hospitals, and there's a human vector component to that. So if you're able to send a robot in to do that work and to be able to sterilize using UV light, then you don't have the same risk of spreading disease from patient to patient because the robot can't spread it. Next slide. So the eHealth technology spectrum, we'll just go through this really quick. Personal computers are, we're going to talk about basically personal computers, mobile phones, tablets, wearables, and what they're able to do. So personal computers are mostly used for communication, information, and telemedicine, while mobile phones and tablets are used for communication, apps, social media, telemedicine, information, health assessment, health monitoring. Wearables are mostly for health assessment, health monitoring, and biometric data. And you can skip 2 slides here. So what does this actually mean for us, though? So one of the things that we focus on in public health is developing countries. And so in thinking about developing countries, I'm left with the question of, what does this have to offer them? Millions of people die each year in developing countries from lack of access to proper medical care. So in one way, you could definitely come to the conclusion that developing countries have the most to gain from the applications of eHealth. There's a global shortage right now of 72 million healthcare workers, and this is expected to double in the near future. And for that reason, being able to use eHealth to connect us to other parts of the globe could be very important. So to be able to have eHealth in the developing countries you need a couple things. And this is where I think the problems are still going to be coming in right now. Both parties involved need to have some sort of device to be able to communicate through. And in addition, you need a reliable internet connection. And after spending time in several developing countries, I know that devices are not nearly as prevalent as they are here in the United States. And in addition to that, a reliable internet connection is a rarity in some of these countries. And so I think that there are still things that need to be worked out to be able to really bring eHealth to developing countries. Some of the applications could be live video conferencing, though, to be able to consult with experts around the world on cases. The review of CT scans and MRIs would also be very valuable, as those are very costly things and somebody needs to be highly specialized and trained to be able to review them. To be able to bring costs down and have that done remotely would be a great asset. In addition, there could be remote monitoring of vital signs. So, next slide. So where are we now? In the United States, healthcare costs are at an all-time high. We are over $9,000 per capita per year. Obamacare, or the Patient Protection and Affordable Care Act, has brought about many changes. One thing is that it prohibited insurers from denying coverage from any sort of pre-existing condition. Well, I think this was great in the expansion of healthcare. It has also, made it so that it's driven healthcare costs up. In addition, the program did mandate that everybody have insurance and be covered by a plan, or they have to pay a penalty. And without getting into the politics of it, those are, two of the biggest points of the Patient Protection and Affordable Care Act. So one of the things that is worth noting, though, is that traditionally healthcare in the United States has not actually been healthcare. It has actually been sick care. The healthcare industry has not been incentivized for keeping patients healthy and avoiding expensive treatments. They have been paid for people coming to them and using their expensive treatments and using their expensive medications. And so I think that eHealth has the potential to empower patients to take control of their health and to practice some primary preventive measures instead of just taking care of health on the back end. Next slide. So projecting the future, where are we going to be soon? Healthcare as we know it will be revolutionized through technology, and this is expected to happen in really the next 15 years. We will have devices and innovative ways to constantly monitor health and give feedback in real time. There's talk about microchipping, which is a little bit scary to me, so that we are actually tracked at all times. Digital medicine will allow for diagnostics that are no longer based on our symptoms or even drawing blood or individual things like that. They're going to be based on our molecular DNA, and that is going to be tracked through devices. It is my hope that this will actually be used to individualize medicine and to bring it down to a place where it is used as a primary prevention tool, and we are able to work more in preserving our health before it deteriorates instead of treating diseases on the back end. Next slide. So here's some food for thought. In public health, we talk a lot about disparities. And my question is, do you believe that eHealth and the use of technology has the potential to bring a larger disparity to healthcare due to vulnerable populations such as the poor, those in developing countries, or the elderly, either lacking the access to this technology or lacking the necessary skill set to fully utilize eHealth? I think this is an important thing to talk about as we move forward, because we do not want to take these vulnerable populations and make them more vulnerable and actually hurt our health outcomes by not taking care of the entire population, but only gearing things towards people that are interacting with technology and the people who have the money to buy the technology. I look forward to hearing your responses, and thanks for listening.